everybody wants to get back to work. And so we're learning about ways to potentially do that. From pre-screening to social distancing within the office, to taking temperature, to air handling, to PPEs, and to reduced aerosols. But one of the things that I know that you've been working on is how COVID testing can help with this playbook. The idea is that dentists could be looking for testing, additionally testing to help, sort of answer the question, is this patient safe to treat, or are they not safe to treat? And so I kind of wanted to get your thoughts around COVID testing, kind of where we are, and potentially does the current tests, whether they be the antigen or the antibody tests, help us to answer that question, which is, are these patients safe or are they not safe? So what do you think?
Thank you, Jason, for that question. Yeah, it's a big concern right now, this whole issue surrounding testing. I should probably start with saying that two types of tests that we can do. We can test for the virus itself. It's a molecular type of test where we look for the RNA of the virus. And the second type of test is an antibody test where we look for the immune response to someone who's been infected. Obviously, the antibody test is for the purpose of finding out if someone has been infected, have they recuperated, and maybe potentially are they even immune. There's no answer to that last one yet, by the way. There's some thoughts about if you've been infected, could you be immune? And that probably is a large issue surrounding dentistry as well. So let me address that one first. There are a lot of different coronaviruses out there. 4 of them cause common cold, more or less, and then we have SARS 2003, and then we had some called the Middle Eastern Respiratory Syndrome in 2012, and now we have obviously COVID-19. So the coronaviruses have been around for a long time. So when we do the antibody testing today, we have to be very careful that the antibody testing we are doing would truly only check for the antibodies against this specific virus, SARS-CoV-2, and should not pick up our exposure to any previous viruses that are in the same family. So that's number one. Number two, if I look at SARS, we have more information about SARS than Middle Eastern Respiratory Syndrome. The immunity that was conferred by after being infected with that virus was around a year, and then it started to wane. We don't know if it's going to be the same thing for COVID-2, meaning if you get infected, will you even have immunity? And if you have, how long time it's going to last? So if you want to test, for instance, individuals that work in your office and say, okay, you have antibodies, that means you are immune, we can treat anyone, we can treat someone who's infected, not infected, we're not putting you at risk. So I would be very careful, today at least, of using an antibody test to see if someone is immune to COVID-19 virus, to the COVID-19 virus, the SARS-CoV-2. So that's the antibody test. The molecular, the antigen test, the viral test, that's a different story. So if you have the virus, obviously you are infected. And if you have the virus, you have potential to spread the infection to someone else. Now, there are two concerns here. Number one is, obviously, can we actually pick up the virus with available tests? And no test is 100%. Each test has their own performance ability to pick up if someone is infected and not infected. And you also have an issue with the prevalence of the disease, meaning if you have a very low prevalence of a disease, even if you have a very, very accurate test, your chances of getting a false positive response is actually very, very high. I'll just give you a number here, for instance. If the prevalence of COVID-19 is around 0.3%, meaning not even 1%, 0.3%, and you have a test that has a specificity and sensitivity, which is the ability of the test to pick up positive and negative values, is high, let's say 99.7%, you get a positive predictive value, meaning you will get only around 50% chance of knowing if a positive test that is coming back comes from an infected individual or a non-infected individual, meaning you have 50% of true positive test results and 50% of false positive test results. So we have to be very careful, especially with a disease that has low prevalence. Now, we don't know the prevalence of COVID-19 yet. So it's very hard to calculate what is the predictive value, meaning it's hard to calculate what is the answer to the question, I get a positive result. Is the patient truly positive or not? The good news is that a negative result today is probably very sure that a negative result today means that you are not infected with the virus. So if you want to test in order to find out if someone is negative, the tests available today are very, very good. They are almost close to 100%. Okay. If you want to do the test to find out if someone is positive, I think we have some concerns. And the bottom line with all this testing is very simple. A test is technically asking a question. And if you ask a question, you need to know what to do with the answer. So if you test a patient and they come back positive, what are you going to do with that answer? What are you going to do with a positive patient? So are you going to treat them? Are you going to treat them differently? Are you going to have different infection control procedures, et cetera, et cetera? Now, and I'm sorry I'm going on and on here, but the diseases we have dealt with until now, and specifically the big ones, the one scary ones, HIV, for instance, was a bloodborne disease. So the problem we had then was, if we get a needle stick, can someone get infected? With COVID-19, which is a disease that is transmitted very differently by aerosol, maybe even by talking and breathing, we should not only be concerned about the operatory itself, we have to be concerned about the front desk personnel. We have to be concerned about people waiting in the waiting room and so on and so forth. And those are issues that we need to deal with before we start doing the testing. What to do with the test result, how to treat patients that are positive and negative. And there are other issues as well, obviously, but those are the ones that I will bring up at the forefront here.